From Chicago's CAN TV, a look at the week's events is reported in the newspapers, in the blogs and online, and on radio and TV. This is Chicago Newsroom.
Well, hi there and welcome to a special edition of Chicago Newsroom. A kind of a special edition because today we're taking a look at an agency that's been serving Chicago for exactly 100 years, helping fund some of the most important public and social service organizations here in our city. In fact, in the past century, Chicago Community Trust has awarded almost $2.5 billion in grants to various nonprofits. So to celebrate this first century, the Trust has been bringing together thousands of Chicagoans for conversations about the future of our region, trying to come up with some ideas for how to make things around here a lot better than they are now. And today, we're going to be talking with one of the people who has been involved in that and will be involved in the future. We're talking about Lawrence Benito. Lawrence, welcome to the show.
Thank you for having me.
Lawrence is with the Illinois Coalition for Immigrant and Refugee Rights, an organization that has done terrific things in Chicago and has been involved in the discussion in almost every possible way, and a group that I really have a lot of admiration for. So happy to have you here at the table.
Thank you, Ken.
So, tell us about this thing called On the Table. This is the 100-year celebration to get a bunch of people to sit and talk about what we need to do as a society, as a city, as a culture. But then I guess, as I understand it, the Community Trust came back to you and said, okay, we're going to do it again, but this time we're going to do it with real commitment. No just sitting around talking this time. We're going to get you to do things.
That's right. So last year we participated just to talk about the issue of immigration overall, and we brought together different sectors that weren't necessarily part of our coalition. People from the faith community, from the labor community, business community, LGBT community, to talk about the issue of immigration and how we could, potentially work together. This year we wanted to take a specific issue, and the issue of healthcare. Given the timeliness of a lot of changes going on in healthcare right now with the Affordable Care Act, with changes in Medicaid, changes at the state level with health coverage. And there are roughly 1.8 million immigrants in the state of Illinois, approximately 500,000 that are uninsured. And we wanted to bring together people from various sectors, community leaders, advocates, funders, and health professionals to think through how do we break down the barriers for immigrants accessing health care. And we're looking forward to that conversation.
Wow. So to be specific about it, then you're going to bring some people together to have food, as we say. It's
That's
all
right.
based on
Yes.
food, right? We're going to have some food, and then we're going to figure out how we're going to get more people into the healthcare system. Is that the basic? Well,
There are a number of things that we're trying to figure out. What are things that we can do at the local level? Is there something that we can, partnerships at the city level or at the county level? Certainly there are challenges at the state level right now that we're trying to figure out. Can we expand healthcare coverage for folks? Every year we go down to Springfield and we fight to advocate that the All Kids insurance program is kept. For many of us, we think that's a no-brainer to have children insured, but the state has challenges and has to make decisions. So we're bringing people across, not just immigrant advocates, but people who care about healthcare, to talk about what are the possibilities. Obviously, government can't do everything, but are there interesting partnerships that we can do with different layers of government, philanthropy, other folks that care about healthcare generally, and healthcare professionals that are doing the work, to see what we can do to get as many people insured or have access to healthcare services as possible.
So what would be your dream outcome? I mean, what would make you say, wow, we really nailed this? What would happen?
Well, and I think we don't claim to know everything in terms of what's possible in certain policies. And so, we're bringing people that work and see this issue from different fields to see, are there specific things? Can we expand healthcare coverage to, a certain age? Or can we work in some of these suburban areas where we've seen evidence of successful programs and replicate it in other areas so that people can get the services that they need, or bring in people or partnerships that can help us with the supports that folks may need to get services.
And is this with an emphasis on immigrants, immigrant populations? Is that, or is that a key part of what you're talking about?
Well, immigrants are about 12% of the state's population. Obviously, it's a constituency that we work with, and that's part of the focus. But obviously, we have a concern for healthcare overall. We receive funding through the Chicago Community Trust to look at policy opportunities and advocacy opportunities around that.
I mean, my guess, and it's probably a prejudice more than an informed piece of information, is that the vast majority of immigrants to Chicago probably don't avail themselves of health care the way they should or could. Mm-hmm. And that it's probably a real challenge to tell people who are, again, we're stereotyping here, but people who are probably limited in their resources and their job opportunities are not that great, to tell them, hey, you should be putting a piece of your family's treasure toward some kind of health insurance, because that would make your family more whole. That's got to be a tough sell sometimes.
Well, if you look at the breakdown, 1.8 million immigrants, roughly a third, 500,000 are undocumented, roughly another third, over 500,000 are legal permanent residents, mm-hmm. And then the remainder, about 700,000, are naturalized citizens. We look at data overall, and if you look at, I recently heard a study that 40% of the Fortune 500 companies were started by immigrants, right? Yeah. So lost in the conversation about the issue of immigration, and those that are not in the country with papers are also, immigrants that have fared, pretty well, right? And people continue to come here, current generations, for the same reasons that earlier generations of immigrants came, for a better life for themselves and their families. And so, I think, like every generation, there are groups of people that need just a little bit of help, to get along the way. But anecdotally, and certainly the information that we've seen, immigrants for the most part, want to contribute, want to give back, and that's part of the story of also why we're bringing folks together around the table.
I'm a little immigrant boy myself, although I came from an English-speaking country, so I didn't have the same issues that a lot of others do, but it can be very difficult to integrate yourself into this culture from outside, and healthcare is a really major piece of it. So you're on the right track. You've got your work cut out for you.
We do, but we think that there's also a lot of folks that want to pitch in and figure out solutions to this. So we're looking forward to the conversation. Appreciate the Chicago Community Trust for bringing us together and really thinking outside the box, because it's not just about dollars, it's about giving of their time. And if we can have folks around the table of helping to think through this, I think we can make some headway.
Do you find just a kind of a final thought here, again, this is a prejudicial thing, but do you find that people who are new to the country are so involved with everything else that they don't have time to be donating their time and treasure and connections to philanthropy? I mean, they got too many other things to worry about?
Actually, I find that counterintuitive. My parents are both immigrants from the Philippines. In many ways, the product of an American dream. My parents were Catholic, and they spent a lot of time donating time to their church. Growing up, and I see that, continue to see that in the work that we do. In other areas of work around citizenship, people volunteering to help people put their documents together, fill out the application, tutor people in learning English. So I don't think philanthropy is just limited to the folks that have money. In fact, I'm finding that people who don't have a lot of resources are still giving proportionally, more of both their money and their time.
That's one of the things that the Trust discovered in their research into philanthropy, that I don't have the numbers right in front of me right now, but the essence of it is that the poor people donate more than the rich people do. So
that's
there
right.
you are.
Yeah.
All right, well, Lawrence, thanks so much for dropping by to talk to us about your experience with On the Table, and good luck with your session.
Thanks for having me, Ken.
Thanks.
Take care.
You've been watching Chicago Newsroom, this little special edition talking about On the Table, and we'll have others like this. You can find them here and there on CAN TV, and we hope that you will join up and become one of the conversationalists and one of the activists who will try to make our region a little bit better than it is. Thanks for watching. We'll see you again soon. Bye.